Today I am going to share with you treatments of vaginal infections. How to identify vaginal infection? Change in vaginal discharge, pain, itching or burning sensation in the vagina, strong fishy like smell especially after sex, discomfort with urination, itching around and outside of vagina, pain during sex, light vaginal bleeding or spotting. First one is bacterial vaginosis. It is the infection of vagina caused by bacteria. 50% of vaginal infection due to bacteria. Grey or off-white non-viscous discharge adherent to the vaginal wall with unpleasant or fishy smell. pH of discharge more than 4.5. Normal pH of vagina 3.8 to 4.5. Minimal vaginal irritation. Next one, treatments of bacterial vaginosis. Metronidazole 500 mg 2 times for 7 days orally. Clindamycin cream once every night vaginally for 7 days. Clindamycin tablets 300 mg also used for the treatments 2 times for 7 days. Metronidazole effective in bacterial vaginitis and Trichomoniasis infection. It is not effective in candidiasis or yeast infection. Doctors considered tablet as the most effective treatment than creams. Next one, sacnidazole 2 gram oral. Sacnidazole 2 gram oral granules is a prescription medicine used to treat bacterial vaginosis in female 12 years of age and older. 2 gram single dose orally used for the treatments. Solosec is also used to treat trichomoniasis. Infection of Trichomonas is known as trichomoniasis. People taking Solosec for trichomoniasis should avoid having sex until they and their partner are treated with the same dose at the same time to prevent reinfection. Second one is Trichomonas vaginal infection. Trichomoniasis is the most common sexually transmitted infection. Risk factor include multiple sex partners and having unprotected sex. Poor hygiene, infected from infected person's towel and clothes. Symptoms: Trichomoniasis cause a foul-smelling, creamy or slightly green vaginal discharge with genital itching and painful urination in women. Men typically have no symptoms. Complications include risk of premature delivery for pregnant women. Strawberry cervix is the sign of Trichomonas infection. Treatment involves both partners. Treatments of trichomoniasis: metronidazole 500 mg 2 times for 7 days. Both partners are used for the same treatments. Stop intercourse or use condom during treatments. Effective in 80% of the patients. Second method of treatment: metronidazole 2 gram stat, then tinidazole 300 mg 2 times for 7 days. Best to avoid in first trimester if pregnant. It crosses through the placenta. Third method of treatment: sacnidazole 2 gram or Solosec. Oral granules used to treat trichomoniasis and bacterial vaginosis in female 12 years of age and older. 2 gram single dose orally used for the treatments. Third one is vaginal candidiasis or yeast infection. It characterized by thick white discharge, itching, burning on vulva, and usually occur at normal vaginal pH 3.8 to 4.5. Very common in women between 20 to 40 age. It may occur due to promiscuity. It means sex with different partners. Immunosuppression, pregnancy, steroid therapy, oral contraceptive pills, diabetes, poor personal hygiene. Treatments of vaginal candidiasis. Personal hygiene is very important. Clotrimazole or miconazole vaginal cream or tablets are used. Vaginal tablets is known as pessary. Clotrimazole vaginal tablets or pessary 100 mg once a day for 6 days. And fluconazole 150 mg oral single dose, both partners treated simultaneously. Oral anti-fungal to be avoided in case of pregnancy. Next one, vaginal pessaries or tablets. Pessary means dosage form to insert the vagina. Suppository means dosage form to insert the rectum. First one is Candid V6 tab or pessary. It contains 200 mg clotrimazole come in a pack of 3 tab. One tab to be inserted every night for 6 nights. Next one, different form and different concentration of clotrimazole used for candidiasis. First one, 7-day vaginal cream. It's 1% clotrimazole cream. Second one is Canesten V6. It is a clotrimazole 100 mg vaginal suppository. It's contains 6 vaginal suppository or pessary. Third one, Candid V gel. It is a clotrimazole 2% cream. It applied in the vagina with the applicator. Next one, Candid CL. It's contain Clindamycin and clotrimazole vaginal suppository. Next one, Canesten. It is 200 mg tablets for 3 days. It's contain clotrimazole 200 mg. Next one, Canesten 500 mg pessary. It's also contain clotrimazole 500 mg. It is for 1 day. Next one, dosage of clotrimazole for acute vulvovaginal candidiasis. Clotrimazole 1% cream once daily for 7 days at bedtime. Second one, clotrimazole 2% cream once daily for 3 days at bedtime. Third one, clotrimazole 100 mg vaginal suppository or ovules once daily for 7 days. Next one, clotrimazole 200 mg vaginal suppository once daily for 3 days. Clotrimazole 500 mg vaginal suppository for single dose only. Depend upon the concentration of the medicine, duration of the treatment will be changed. This regimen also work against Trichomonas, Staphylococcus aureus, Streptococcus, Bacterioids, Fungal and Leishmania. Next one is combination treatments. Combination treatments is mainly contain one antibiotic and one antifungal medicine. First one, Candid CL vaginal suppository. It contains Clindamycin and clotrimazole. Next one, Cansoft CL vaginal suppository. It contains Clindamycin and clotrimazole. Third one is Clindgen vaginal suppository. It is also contain Clindamycin and clotrimazole. Combination of medicine used to treat vaginal infections caused by bacteria, yeast and parasitic infections. Next one, miconazole ovule. It contains 400 mg miconazole. It contains 3 ovules for 3 consecutive nights. Miconazole gel also used for the treatments of vulvovaginal candidiasis. Example, gynodactyline, gynocandisol, candisol. Next one, different form and concentration of miconazole. Miconazole 7, it's contain miconazole 2% cream. Next one, Gynodactylium vaginal cream, it's contain miconazole 2%. Next one, Gynodactylium 200 mg ovules, it's contain 7 ovules for 7 consecutive nights. Next one, Gynodactylium 1200 mg, it's contain 1 pessaries only. Next one, Gynodactylium 400 mg, it's contain 3 vaginal capsules. Next one, Mycoheal, it contain miconazole 3 vaginal suppository. Dosage of miconazole for acute vulvovaginal candidiasis. Miconazole 2% cream once daily for 7 days at bedtime. Miconazole 100 mg vaginal suppository once daily for 7 days at bedtime. Miconazole 200 mg suppository once daily for 3 days. Miconazole 1200 mg suppository 1 day only at bedtime. Next one, Terconazole vaginal suppository or cream. It also contains 3 ovules once daily for 3 consecutive nights. Terconazole cream contains 0.4% terconazole used for the treatments of vaginal yeast infections. Gynoterazole vaginal cream contains terconazole 0.8%. Different form and concentration of terconazole. First one is terconazole vaginal cream with 0.4%. Second one, terconazole vaginal cream with 0.8%. Third one is terconazole vaginal suppository with 80 mg. Dosage of terconazole. Terconazole 0.4% cream once daily at bedtime for 7 days. Next one, terconazole 0.8% cream once daily at bedtime for 3 days. Next one, terconazole 8 mg vaginal suppository once daily for 3 days. Next one is Povidone iodine. It is used for the treatment of vaginitis due to candidal, trichomonas, bacterial, non-specific or mixed infections. It available in the form of ointments, gel, pessary and vaginal wash. Next one, different form of Povidone iodine. First one is betadine vaginal pessaries. Second one, Povidone iodine betadine vaginal douche. Third one, betadine feminine wash. Fourth one, betadine vaginal gel. Next one, dosage of Povidone iodine. Betadine vaginal douche used as a vaginal cleanser for treatment of vaginitis due to candidal, trichomonas, bacterial, non-specific or mixed infections. For treatments of vaginitis, use once daily for 14 days, including days of menstrual flow. For personal hygiene, use twice a week. How to use? Gently insert the applicator nozzle not more than 3 inches into your vagina. Squeeze the bottle slowly, allowing the liquid to flow freely out of the vagina. Use this medicine while sitting on the toilet or standing in a tube or shower. You should not use Povidone iodine vaginal for longer than 7 days without medical advice. It contraindicated in pregnancy. It gets absorbed and affects fetal thyroid, especially in second and third trimesters. Next one, betadine wash and pessary. Betadine wash used twice a day during menstruation. Use twice a week only for regular wash or protection. Betadine pessary put 200 mg deep into the vagina once a day. It is advisable to insert in the vagina evening before bedtime. Next one, betadine pessary dose may increase or decrease from 7 to 10 days according to the age and symptoms. Betadine vaginal gel, 1 applicator full, about 5 gram, is introduced deep into the vagina every night for 14 days. Next one is steroid containing ointments. Steroid medication are used when severe vaginal irritation, burning, pain, and also ulceration, thickening of local skin. Always prescription cream contains steroid with antibiotics. Clobetasol is very strong steroid. Prolonged use should be avoided. Duration should be 7 to 10 days and it should be withdrawn gradually. First one is Lobate GM. Lobate GM Neo Cream is a combination of 3 medicines: clobetasol, miconazole, and neomycin. Clobetasol is a steroid medicine. It reduces the skin, red, swollen, and itchy. Miconazole is an anti-fungal which stops the growth of fungi. Neomycin is an antibiotic which stops growth of bacteria. Steroidal cream reduces redness, itching, and swelling of vulva. Generally once or twice daily for 15 to 30 days, depend upon the infection. Similarly, you can use Tenovate NM and Topifort MX 15 ml solution for wash. Thank you for watching.